What is sleep apnea and what are the risks?
Sleep apnea is collapsing of your airway while you're sleeping at night, and when that happens you're not getting the air that your body needs, and when that happens your body has to have micro-arousals to wake up, which can cause you to be tired all the time.
So I actually stop breathing?
Yes. During the night when your airway collapses, it can be as much as 100 times an hour that it collapses and you just can't get your air that your body needs.
If I snore, do I have sleep apnea?
When you snore, there's a much greater risk of having sleep apnea. At least 50% of all snorers have sleep apnea.
Why should I consider oral appliance therapy?
Oral appliance therapy is an excellent way to be able to enlarge your airway so that it doesn't collapse while you sleep. It also will decrease the amount of snoring that you have. There are numerous appliances that can do that. What they do is moving your lower jaw forward, and by doing that it opens the airway, and when your airway's open you can breathe better. They allow you to open and close, and when you're opening and closing you have freedom of what you want to do with your mouth, and it gives more room for the air to pass through.
Is this like a CPAP machine?
This works in a much different way than CPAP. CPAP works like if you're blowing up a balloon. It keeps your airway enlarged for that way. With oral appliances, they're much more portable. You don't have to be tethered down to anything. You are able to travel more easily with them, and many people have very good success with the use of oral appliance therapy.
What general steps do you recommend for treatment?
Well, when we're going to be considering this treatment, first we like to have a consultation so that we can tell you exactly what we're doing and why. And then it's important to have a diagnosis so we know what your condition is and how to solve it. And then we'll do an exam and take records for making the oral appliance. And with that, we'll be able to give it to you and then do follow-up appointments to make sure that it's being used to its optimum.
So will I need a sleep test?
Yes, we need to have that so that we know what your condition is. We need a diagnosis, and with the diagnosis we'll know what type of treatment you need and how best to perform it.
What are some of the side effects?
As with any sort of treatment, there are potential for side effects. With oral appliance therapy, there's a bunch of minor ones like excess salivation or dry mouth. And there's a couple that are major, like jaw repositioning, and we do everything we can to prevent that. We're very aware of it and very aware of what we need to do to prevent it.
Are oral appliances covered by insurance?
Typically there is coverage through medical insurance on this treatment.